Hi, I'm so elated to meet you in the program of 1 minute, please. What is vitamin D deficiency? When vitamin D level is below 12 nanogram per ml, that is called vitamin D deficiency. If it is between 12 to 30 nanogram per ml, then it is called vitamin D insufficiency. If you maintain between 40 to 60, then you can claim that you have normal level of vitamin D. So what is the function of vitamin D? Of course, we are all aware that vitamin D is associated with bone health. It absorbs calcium and phosphorus from the intestine and the kidneys. In fact, it inhibits bone resorption and it promotes bone formation. Apart from that, there is some conflict association between vitamin D deficiency and the onset of cardiovascular disease and type 1 diabetes. They say that vitamin D deficiency may be associated from head to foot, namely lack of sleep and depression and onset of cardiovascular disease and onset of type 1 diabetes, and vitamin D deficiency promotes insulin resistance, and they say it is associated with cancer and so on. But what we have to remember that the vital study clearly demonstrated that the replacement of vitamin D failed to demonstrate the reduction of incidence of cardiovascular disease. Now, what they have confirmed that definitely vitamin D deficiency is associated with osteopenia and osteoporosis in the adults and the rickets in the children. But otherwise, there are many theories that are getting emerged with vitamin D deficiency and the association of the onset of the above disease, what I have mentioned. So, what are the sources of vitamin D? Please remember that vitamin D is very much scant in vegetarian diet. It is strongly recommended that if you consume 100 gram of fatty fish, namely mackerel and sardine, these small fatty fishes, if you consume 100 gram, it is able to serve or it is able to fulfill the 50% of your daily requirement of vitamin D. Otherwise, consumption of egg can yield 10% of your vitamin D daily requirement. Then if you take vegetarian, they say that the mushroom that is harbored and exposed under the sun may give rise to 10% of your vitamin D requirement. Otherwise, vitamin D is absolutely derived from fish. Then apart from that, if you are exposed to sun, probably you can synthesize vitamin D. They say if you expose 40% of skin of your body, then probably you can synthesize significant amount of vitamin D. When you are exposed to the skin, the 7-dehydrocholesterol that is present in the skin is converted into vitamin D. Then this vitamin D should undergo two process of hydroxylation, namely at liver and the kidney. Then only it is converted into 125 hydroxy vitamin D3 that is considered as active vitamin D3. So when you are exposed to the skin, 7-dehydrocholesterol is converted into vitamin D3, which in turn should be hydroxylated at liver to 25 hydroxy vitamin D3, which in turn further hydroxylated to 125 hydroxy vitamin D3 at kidney. So 125 hydroxy vitamin D3 is considered as the most active biomarker of vitamin D function. But if you measure 125 hydroxy vitamin D3, sometimes it will give highly volatile and false value because the half-life of 125 hydroxy vitamin D3 is only 4 hours. That's why we prefer vitamin D3 estimation rather than 125 hydroxy vitamin D3. So through pathophysiology, now we can derive the causes of vitamin D deficiency. First, when you are not exposed to the skin, then definitely vitamin D deficiency may ensue. Then when you have kidney and liver disease, then probably you may have vitamin deficiency. That is the reason when you look at the treatment of CKD, then 125 hydroxy vitamin D3 would be the part and parcel of treatment of chronic kidney disease. How will you treat vitamin D deficiency will be seen in the next session. Thank you.